So, hello, listener out there. Welcome to our episode today. My name is Gabriel, okay? And on behalf of everyone at MedInsights, I welcome you on board today. What we are trying to do with this podcast is to interview people that have been working in the healthtech space for a while, founders, professionals who have experience of probably transitioning into healthtech, or they've been working in healthtech all their life, so that young people and young professionals who want to come into the tech field, can kind of have insights into how they can navigate their career path in that regard. Yeah, Adekunbi Bello is an accomplished professional with extensive experience in health technology, client services, and strategic leadership. She currently serves as a team lead for client operations and partnerships at Grey Insights Limited, and she has built a reputation for driving innovation solutions in healthcare information technology, as well as fostering impactful partnerships to optimize client outcomes. So yeah, this is a lot. As co-founder, as co-founder and CEO of the Nutrition Network Africa, she provides strategic oversight for business development, resource allocation, and ethical leadership, integrating business strategy with patient-focused solutions to advance global health initiatives. So yeah, it's a project management. I think you have a training as well in project management at the University of East London. So yeah, good. Welcome.
Thank you very much, Gabriel. I'm sure maybe you roasted my LinkedIn, and thank you very much. Of course, I was the team lead at Grey Insights. They were both my previous roles, and I was the co-founder at the Nutrition Network Africa, where we founded the health tech product Cito Health. But like I said, our ex co-founder. So currently, because let me just give you a background. Yeah, so that you would have context. Hello, everyone. My name is Adekunbi Bello. I'm a healthcare professional, specialized in operations management, program development, and creating effective and accessible healthcare services, right, to people in Africa and in diaspora. My experience have spanned working in the traditional healthcare settings, working in aviation medicine, to general practice, to mental health and rehabilitation services, nutrition and dietary services. Currently I'm pursuing my Masters of Business Administration at the University of East London. So my journey has evolved from working from traditional healthcare services to transitioning into health tech and co-founding my own organization. And one of the things that's always stood for me has been that I'm providing social impact, right? Making social impact through healthcare, because I believe that healthcare is a social and personal issue, and it's very important for us to ensure that the human side of healthcare is always evident in all our service deliveries. And that's one thing that's propelled me and has been like my springboard in all the roles I've held, from co-founding my own product to working in healthcare services. That has been my span. Currently, as studying for my MBA in healthcare, I am very interested in the business of health and well-being. And growing up, I thought for you to work in healthcare, you had to be a doctor or a nurse, right? And for me, I do not want to, like, the blood and all the surgeries and everything. I do understand, but dabbling into healthcare and realizing that there are also intricate aspects of it, that you necessarily do not have to carry a stethoscope, right, or perform some form of phlebotomy services, right, to be in healthcare, really changed the game for me. And then using technology to make sure healthcare is more effective and accessible. Yes, that was right. That was when I found, okay, this is my calling. Yes, making sure healthcare is accessible and effective for everybody using technology.
Okay, so that means you've answered my first question. But yeah, I think I agree with you on that. Sometimes you think, should I go for profit, non-profit? And then you see different roles. Do I want to be a sponsor? Do I want to be maybe a project manager? Or do I want to work in the clinical setting? There's a lot of opportunities that abound in healthcare. And I think that one of the questions I used to ask whenever because I'm into global health as well, is should healthcare be handled by private or by private for profit or non-profit or not for profit? It's a good question that I kind of pose to anyone kind of speaking to in healthcare? Because sometimes we think it will only be the non-profits, and then you realize the big pharmas are there, the for-profits are very important as well and all. So that's very good. Thank you for that intro plus answering question one. So the question two now is, so at what point in your career do you say, okay, health tech? Like, at what point?
Okay.
Yeah.
So, like I said, it's been quite interesting that I never wanted to work in healthcare. It was like it was not even in the works for me, but like destiny, right? As always, yeah. So I got a job. No, firstly, I worked in health insurance, right? I worked in health insurance for a couple of months, and then I got a job at an hospital. And entering into the hospital, I realized how traditional, like, the hospital system was. You have to go through a lot of things to retrieve files, the way traditional hospitals were. And for me, it just didn't work. And, like, it was very strenuous. It was very, it was very stressful. The patients are always like throwing tantrums and being upset, which they are actually meant to, because when you've been coming to a particular hospital for 30 years and it takes them about 1 hour to find your file, anytime you need to see a doctor, there's a problem. And one of the things I introduced then was how we could make the electronic medical records accessible, like how we could make the medical records electronic. And what we did was, it was more or less like my initiative, right, was to implement a solution, right, that helped the patients and the medical providers to store, access, and retrieve information as it went due. It was quite strenuous because these are people that have been using paper-based methods for the longest of time, right? And having to introduce this solution, this technology that a lot of people are not familiar with, it was quite challenging. But I'm happy that we're able to walk through that, and that really just solidified my interest in technology, making healthcare interesting, making healthcare and technology seamless, right? Making healthcare seamless using technology, right? So I saw how it improved our response times, right? And it reduced patient delay, because we had different sections of the hospital. There was the gynecology to the oncology, and then it was quite easier when you just put in a patient's name and you're able to see all their records from when they started using the service, and even retrieving records from other organizations or other hospitals where they've received care. It was quite phenomenal, and it was one of those things that just solidified my foot in healthcare and in the operations aspect and management of healthcare. Yeah.
Okay. Thank you so much for that. So I remember as well. I think one of the people that supervised me during my master's in global health, I think he worked on something like that in Kenya. And by I think he used even Google Form. I don't know, is it Google Form or something? Just integrate Google Form with maybe Google Sheets, and that was like the solution.
Yeah, it's the basic solution.
Yeah, it's not really like until you build an app. It's not until you build software. Before you are into technology. Technology is just basically solving problems with using an innovative approach that is against the traditional normal setting of everything. So, what are the challenges now? Like, to be specific, what are the challenges that you've encountered working on both sides and moving from one side to the other?
Okay. So one of the things I've experienced, right, one major thing I've experienced is people being technophobic, right? Especially when they are used to doing things in a certain way. Okay, people have to wait 2 weeks to get appointments, and I'm like, why do we have to wait 2 weeks? I remember before COVID, right? A lot of our services, like in my previous organization, our services were mostly 9 to 5. So if you cannot make an appointment between 9 to 5, then you cannot have access to a professional. And mental health is something that cannot wait. Health generally is something that cannot wait. When somebody needs help and assistance, it's important to provide proactive and prompt support to them, because time will determine if this person is going to survive or not. Right, and we know how these things work. If you've worked in healthcare, you know how things can change from 0 to 100 in space of like minutes. So why should people wait several days, several hours before they receive the care that they urgently need? Like, so one of the major issues I had was that issue of, number one, people had to wait long days, long hours before they could access care. And one of the things I did, this is pre-COVID, right? When COVID happened and then everybody had to stay in their house and you are not allowed to, like, even if you want to have a hospital appointment, you have to go through some stringent measures to see a doctor. One of the things that I did then was to introduce digital health solutions, right? Like having virtual appointments with your organization. So I would say that back then, that was in 2020, 2019, it was one of those, I would say I was like, my program was one of the pioneers of being able to access mental health services from the comfort of your mobile phone, right? And people were able to even access services after the usual hours, which is 9 to 5. They were able to access mental health, because some of the issues people always like shared with us was that, I don't want to speak about my mental health when my children are awake. So they could access services at 9 p.m. when they've put their children to bed. It was something that was a game changer, and we had a 47% increase uptake during that period, just because people were able to book appointments outside the regular hours. So I believe healthcare should be something that should fit around your routine, right? And that is the future of healthcare, when you do not have to wait for the regular 9 to 5 access to doctors, 9 to 5 access to professionals, when healthcare is ready at your fingertips. And that is where we are going to. So the challenge was majorly having to integrate technology, ensure that people are able to be receptive to using technology to book their appointments, and also ensuring that the medical professionals, because a lot of medical professionals were used to the regular traditional paper pencil method, and then ensuring that they could still deliver their services without it being watered down over virtual platforms. And so it was a game changer. Really, it helped people to access healthcare more.
So I think the problem of healthcare access, thinking about it, because I've actually lived in not just in Africa, like I've lived in a setting where you see that yes, they have healthcare access problems as well. So for example, once something is not like an emergency, they can schedule you for like maybe
they schedule for like 2 months.
So I feel like it's a global problem, but just because I think the problem with the African side of things, sometimes like the resource limited settings generally is the fact that patients sometimes are not really put at the center. So, for example, even they will tell you if it is not an emergency, can you wait for 6 months? Can you wait for 6 months? All those things. But you don't even know if the specialist will be around. There's no proper scheduling and everything, no follow up. And then sometimes people don't, people can't even pay, for out of pocket.
Out of pocket, yes.
So I feel like the dynamics are different. The problem is that kind of general on different scales. So the approach to health really needs to change. Thank you so much.
Needs to change, yes. And that's what the future of healthcare is going in. That's why you and I are working in this space to ensure that healthcare is accessible and effective for people going forward.
Okay, so I think a sensitive part of this is data handling, so data governance and the like. So
absolutely,
work in mental health and the like. How are you able to gain trust from those people to share all the information they were sharing, and how do you really navigate those those intricacies? Ethical data concerns.
Thank you, Gabriel, for that question. And I would like to pose this question to you as well. You are human as well, right? And how would you want your healthcare information handled? That's where we come from, majorly, right? That if this was us or it was a family member, right? How do we want this information handled? And that's where the GDPR, the NDPR policies came into being. I remember facilitating a training on GDPR, I think in 2021, for my team then, right, on implementing the GDPR policies and NDPR policies as regards patients, handling patient data, and showing the patients how their data are managed, how they are handled, and how they would be deleted after they've accessed the service. It was quite challenging because a lot of people didn't understand all those very technical things and all of that. So we had to make it simple. We had to make it simple that anybody could absorb it, because all the many technical medical jargons might not make sense to the ordinary person. So one of the things that we did was to ensure that there were access levels for different levels of professionals. Yes, so there were different access levels. There was regular data checking. We had a data administrator, somebody that was in charge of, or if there was a data breach or anything. And I'm glad that during my time, we never had any form of data breach, because we had consistent training, feedback, and check-ins to ensure that our systems are well armed against infiltration. Of course, you will get all those funny phishing emails trying to like sink their teeth into your data. But it was quite important that we had that data and safety measures in place, right? It was quite expensive to implement, because we had to get professionals to ensure that our employees are trained, and then the different levels of access, ensuring how data is processed, is stored, is saved, and all of that. But it was quite important. And then another thing was ensuring that the people that are handling this data, they know the importance, right, of confidentiality, right, of privacy, right, and also that, if this was you, how would you want your data? Like, make it personal to them. Ensuring that the human touch is still there, and then at the same time ensuring that this data is confidential. And then you said something about how were we able to gain the trust, right? How were we able to gain trust? Trust me, when we were trying to sell mental health in the corporate space in Nigeria, we faced a lot of challenges. A lot of people were like, no, I can't do this, because what if they tell my manager? Right. But so one of the things that I implemented was, one of the programs that I created then was the awareness campaigns. So you would see me, I would go to different organizations, different financial institutions, talk about FMCG, to do awareness programs, like to talk about these things. And sometimes we bring the professionals. So, those professionals that I feel that are so far away, we bring them down to their offices, and then we create like sessions in different, safe spaces for them to talk about these things and show that these are the things we have in place, and that these are the things we are liable to if your data leaks. Do you understand? So these were the things that were able to put people at ease and make all these organizations, all these corporate organizations, have a buy-in into the service. It's a lot of work, trust me. It's a lot of sleepless nights, but it was all worth it in the end. So those are the measures we put in place to ensure that data is not leaked and every information is confidential. Because how would you feel if it was a family member and then the information is out there? How would you feel if it was you?
So I agree with you on that, and that's why sometimes when I talk to like early career founders, and they start telling me about the issues they have is maybe building the app, building this, but I'll be like, sometimes you really don't understand what the problem is. The problem is not really building an app. Anybody can really build app. The fact that you have a solution or an invention doesn't mean it's an innovation. Like
innovation,
innovation and invention are different. The fact that you can build something, there are a lot of intricacies. You have to manage data. How do you regulations? Are you even sure? Or like we've had fintechs in Nigeria that were closed up. You should be aware of this. Just because they didn't have the right document, they didn't have the right certification from CBN and all that. So it's not just the product, really. I feel like solution is not just the product. It's how you're able to, take the product into the market in a very safe way, that you don't have any irregularities, issues with regulators, and then you now have buy-in from that. Yeah. So it's not just, I feel like there are lots of, and that there's a need for maybe legal advice or all those things.
Absolutely.
But speaking in that regard as well, what would be your advice to, since you've been a founder, you've worked with founders, I know, and then I'm sure you will still be interested. This one that you're doing on MBA, I'm sure you have.
Absolutely. I found, so it's quite interesting that personally, I found my niche. I love well-being. Wellness is a part of my life. I cannot run from it, right? And I understand. So when I was like still up, like when I was working back in Nigeria in healthcare, one of the things that resonated with me was when a patient, right, or a client comes to me and tells me that, oh, Kumbi, because of what you did, or because of what your team did, or what you said, I was able to come out from a dark place. Or Kumbi, because of I was able to use this service that you recommended, I was able to navigate this life issue. That's it for me. right? The impact, the change, the way the way lives are impacted, the way lives are changed, right? And that's why healthcare is very sensitive. Healthcare cannot wait, right? So, and it's important that everybody working in healthcare knows the urgency, right? And knows how important the work that they do is. Because trust me, if there's some form of doubt, or there's some form of hesitation, right, on your part as a healthcare provider, the patient already lost trust. The patient already loses like their trust or their confidence in what you're trying to do. So it's very important that as founders that we are very close to the communities that we serve. It is very important to know that it's not the most like technology service solution that is it's about fulfilling the needs, the basic needs. Are you really solving a problem? I was able to supervise a project recently on making healthcare accessible to rural areas, right, in Africa, and just by the mere reminders like text messages in their local dialect, right? That was the game changer.
That was the change,
Do you understand? Ensuring that these people they are talking about, you're not just looking at those in global cities, those in urban areas, but those that are in the interiors. How are we accessing them? Like it's an untapped market. Absolutely. And I know how difficult it can be, but I want us to start thinking out of the box and ensuring that untapped market, they are being they're not being ostracized, but they are in our radar. We are building and we are thinking for them and thinking how we can make healthcare easy and accessible for them. I understand for healthcare, there are a lot of legal frameworks, there are a lot of things you have to put in place. It is very important for us to dot our I's and cross our T's, because if we do not have all of these things, right, we would be faced with litigation and a lot of things. So it's better you just do it right and do it well, actually. So it's a lot, and I'm also calling on government, right, to assist healthcare founders, to assist people in healthcare, like privately owned healthcare enterprises, to ensure that because trust me, we still have a lot of backlog, right? The services the government provides is still not enough. So we have to still have privately owned medical institutions. So it's always important that we have investments from government, from venture capitalists, because we know it's the almighty fintech that they're always running after. But then there's gold. The healthcare is a gold mine as well, right? But getting it right and ensuring that we are serving the people that we are building for is where we should start from.
I don't think we've had a unicorn in Africa that is a healthcare. I don't think. Do we? No.
Not yet.
Not yet.
But I believe
we have a lot of,
very soon. Yes, we have a lot of great healthcare products from Health Tracker. Health Tracker is amazing. Health Tracker, they're really the disruption in that space, right? In the diagnostic space is amazing.
I was trying to get one of them to interview as well. Like they are doing so much, and then I think one of the early ones that are doing so well. LiveBank is doing good.
LiveBank is amazing.
Is it Mama Health? Adekunbi, what's his name? This that they just opened the office, I think last year or 2 years ago in Lagos.
If you tell me the name of the
they have Mama Bots as one of their solutions.
Mama Bots. I'm not sure I know them.
I've forgotten. Adejare, I think one of his name is
Adejare. I'm not sure, but there's also Ilium Health. They're into there's Ilium Health. So the thing is, in healthcare, there are different aspects you can come from. For example, Health Tracker, Dari Johnson, she came from the diagnostics aspect, and then there's the electronic medical records aspect. There's the health insurance. That's the insurtech aspect of things. It's quite like healthcare is quite diverse. I just feel that when we see a problem and a need, we create a solution that actually solves it. And you don't have to start big, right? Start small from the day-to-day person, from the regular Taye to the regular Dare and to the regular John and Emeka, and see how you can make their lives easier or make their health better and their well-being better, because it just starts with one person. And your why is very important. In my experience, I've been able to work with different healthcare professionals. It was quite challenging at the beginning because working with the tech guys, which are the software engineers, and then the psychiatrist, and then the oncologist, and then everybody's speaking different language. Like the doctors are saying this is what we need for our patients to get better. The software engineers are saying we don't understand what you need. Can you? So one of the things that one of the initiatives or one of the programs that I always advocate for is that let the software engineers, let them shadow the doctors. Let them see what their day-to-day looks like, so they can build a solution for it. You cannot build for something you don't know.
Yeah, understanding is important.
You cannot bid for something you don't know. I remember when I was working in health insurance, and then I didn't know a lot of things. I had to do research. So right now, I can tell you that people used to call me then, I'm a walking Bible of health insurance, especially in Nigeria. All the policies, all the things that these policies cover, I have it, because it was not necessary for me to do it, but I knew that if I was going to excel in this field and be able to provide solutions to our patients, I need to know these things so that at the top of my head, I'm able to recommend things to people, share insights on, like, okay, this is what you have access to, right? And this is the level of care you can have access to with this plan that you're on. So it's very important that we all know what our why is and find a way that we can all collaborate together and see how we can build solutions that would put Africa on the map. I know we already have people doing that, and I know that the sky is definitely the starting point for us.
Yeah, and I like the point you raised about the informal setting. I think listening to this founder, MoneyPoint, that's one of the things he said about when he was trying to talk about his company on is it Founders Connect. I've forgotten this lady's name now. Founders Connect. I think she was interviewing him or something. I don't know, but I know he was talking about how he just realized that there's an untapped market in the informal setting. You know, the day-to-day Yaloja, they also want to be in the banking system. Like they also want
MoneyPoint really disrupted.
Yeah, that was not
absolutely.
And that, I mean, they're the unicorn now, so they're doing so well. They're unique. I think they are the latest unicorn. I think so. Yeah. Last year we had 2 unicorn in Africa, one in South Africa and one from Nigeria. MoneyPoint.
Nigeria, yes. Really, and I know that we can build a MoneyPoint that would be health tech in Africa. Yes, absolutely.
Yeah, I think it's just being able to situate whatever we are working on at the intersection of where people will actually pay for, where investors will want to invest in, where governments will not have issues with. You know, I think that's what we've not really had. Something that would really scale. You know, so sometimes now you have a lot of things, but they're working in Lagos. You should know what I'm talking about. They're working in Lagos, they're working in Abuja, Port Harcourt. But if you take it to, let's say, Igbo or one local community, do you understand? So we just need that thing that can easily, and that's what MoneyPoint was able to do. As a chief of a big company, MoneyPoint, you want to have a MoneyPoint account, like you don't have issues. And then, sorry,
it's all right.
So when there's no movement, the light goes off. And then
okay, it's all right.
That's saving. And then you in the village as well, you want to be able to collect money without having cash. So everyone wants to get their MoneyPoint, what's it called? MoneyPoint, what do they call this? The POS and everything. So
POS, yeah.
And then you can even open, I think the most easiest of it was like the fact that you can open a business account without any stress. Because that has been the issue in Nigeria, really. Like, I have to go to the bank, submit this, submit that to have a business account. And then by just, scanning your documents and everything, they were able to, man. A lot of people have tried to do that, but they were I feel like they were like the first, apart from OP is doing well as well. They were like the first to break down the problem.
Really break make it accessible,
so easy. Like
because trust me, even in quotes, you would classify me as somebody who should be tech savvy and all of that. But trust me, if your solution is stressful to me, I'll find a simpler one.
And it's true. Like there's a lot of apps. Like why should your app stress me?
Do you get? Like I don't even have like my times, my focus time is like 5 minutes.
Yeah.
And then I'm having to do that. This even happened because I was trying to get a client to pay me, right? And I was trying to use a particular service and they were asking me for some things that, and I'm trying, like, I have another documentation I can
Yeah.
use. I just went to somewhere
Yeah.
else and I was able to do it within 10 minutes. I'm like,
Yeah.
okay, you're lost.
Yeah.
So that's what
Maybe the stress.
happens,
Yeah.
right?
Maybe the stress.
Yeah, that's what happens.
So being able to solve problems and solve problem, yeah, you're solving the problem, but the people you are solving the problem for find it easy to leave what they are used to. I think that's yeah.
Yes,
Yeah, because if you're trying to solve problem for
absolutely.
me and your alternative is easier and they're doing the same,
Yeah,
I'll go with the other person.
yeah.
Yeah. Okay. Thank you
What?
so much. Do you have any other thing to add? Maybe an
Yeah,
advice?
so I just wanted to add what you
Okay.
said. Like you said, solving a problem is good. For the person you're solving a problem for, they have to know that you're solving a problem for them and they are ready to use your problem, your
Solution.
solution. I remember when we were building Cito Health and we built this amazing app that was very like very savvy and all of that. And then we realized that our market, the people that really will use Cito Health are people that are a bit older
Mm.
because it was a health technology app that provides nutrition and dietary support to people managing chronic illnesses. And who are the people that are mostly managing chronic illnesses? They are people in their mid
Yeah.
40s. Of course, we have younger people too that have some of these chronic illnesses, but our majority,
And
right?
those ones are
So
not as tech savvy as
tech
the
savvy. So what did we do? We brought it to WhatsApp.
yeah.
All our parents are on WhatsApp.
Absolutely.
Right. And they
Absolutely.
report it to WhatsApp. So instead of having to go to the app and book, we have everything ready and automated in WhatsApp. And that was a game changer for
Yeah.
us because we were able to reach out to our clients, to the people that majorly use our services on the platform they are able to relate with the most and they are most comfortable with. So these are the things that like I just like you said, building for those people that you are building for and ensuring that your solution fits their lifestyle. Their
Yeah.
solution fits their routine.
Yeah.
It's quite like it sounds very simple, but trust me, it takes a
Yeah, it
lot
did.
of
Yeah, I agree with
yeah,
you. So
yeah, it takes
I
a lot of
remember when
work.
I was doing my master's, the project I did was a feasibility study for a mobile app that measures blood pressure. And when we're doing all this literature review and everything, that was how I realized, when you look at literature, you kind of see the fact that if you're doing anything in technology, the segmentation has to be good. Like in terms of the target population you're working with, determines how you're going to, how will I put it now?
Scale,
No, not just skill. How you are going to implement the solution. So yes, this
implement
is the solution.
solution.
So let's say you are building an
Yeah.
AI now. Yeah. For example, as I said, so if it's the elderly population, as you said, the AI might be like a WhatsApp bot now because elderly
Mm,
people are on WhatsApp. And then if you're looking at maybe the Gen Z and the like, maybe you have to look at another app, maybe an Instagram chat
absolutely.
account, maybe you're chatting on Instagram or TikTok or something. I don't know, something around
Mm-hmm.
that area. And then maybe Mendelian as well, another thing entirely. Maybe
Thing
like something that
entirely.
maybe like a
Yes.
mobile, like a desktop app, like an app that will be on their desktop because I feel like millennials are kind of used to desktop and all that. So yes, you have the solution, but you have to now be able to cater
Find a way
for
to
all the
implement it.
segments. Yeah.
Absolutely.
Yeah.
And I see a lot of artificial intelligence like going forward in health. I see a lot of artificial intelligence in becoming very quite important in healthcare. But one thing that I want everyone to remember is that you can never really eliminate the human aspect of health. You can
Yeah.
never really eliminate
Yeah.
it. Of course, AI will help us with predictive analysis, which is
Mm.
something that is so phenomenal. And we're already
Absolutely.
seeing it
Brilliant. Brilliant.
currently in healthcare, right? Being able to predict symptoms from your current lifestyle, from your family history, and all of those things.
Yeah.
But the human element in healthcare cannot be eliminated. So we will always find a way to find a balance between using technology and health and then finding a common ground and ensuring that in all of this, our patients are still at the center of the solutions that we
Yeah.
build.
Yeah. Patient-centered
Yes.
care. So thank you so much. I
Thank
think
you,
that would be nice.
Gabriel.
I think lastly, just to, because our major audience, a lot of our people that listen to us are young people that are still finding their feet, coming out of uni, NYC,
Mm-hmm.
internships and all that. So if you have an advice, I mean, what would it be to someone who is trying to trying to channel and trying to find their place in the world? Should I go in this direction? I like
Mm-hmm.
technology, but I'm still an healthcare student or
Mm-hmm.
public health student or just
Yeah.
coming out of school.
Okay, so what my advice would be would definitely be open minded. right? And like I said, my background is in no way related to healthcare, but I found myself in healthcare and be ready to do the work, right? If you are interested to, like I said, first and foremost, be open minded to opportunities. If you are presented with an opportunity and you feel it's something you can take, please take it on, right? Be open minded. And another thing is be ready to do the work. Healthcare is not beans. It's not a walk in the park. It will test you. It will test your health as well. Like it will test your health because you're bidding for
Yeah.
people. It will test you. But you need to always know your why. Why are you doing this? Why do you want to move from point A to point B? You need to know your why. So first and foremost, be open-minded, be ready to do the work, and then know your why. It's very important. These are the things that I'm not going to tell you things that don't work. I'm telling you things that work for me, right? Things that work for me, and I feel like you can also implement on your own end. Don't say because I have a BSc in geography, I can't work in healthcare. Trust me, my darling, you can go into healthcare. You just need to be ready to do the work. You be ready to put your feet on the ground and then run with it, right? So whatever opportunity presents itself, be open-minded, be ready to do the work, and know your why. Your why, the days that you want to give up, you want to throw in the towel, your why would always be what will bring you back. So thank you so much, Gabriel.
Thank you so much. And lastly, now, if there's anything you're working on, or if there's a way you want people to connect with you, probably working on a research, a project, or anything that
Yeah,
you want to, so that people that are listening can also know where to get you, and like
yeah,
on LinkedIn or something, and then
yes.
reach out to you for as well.
Okay, so okay, fine. You can follow me on LinkedIn. You can connect with me on LinkedIn at Adekunbi Bello. I also have my website. On my website, I provide consulting services for businesses trying to grow because I have a very extensive experience in business development and operations management. kumbibello.com. You can connect with me there. You can connect with me on Twitter, on Instagram at Kumbi Bello. Right, my name is like just like that across all platforms. And if you're on TikTok, I'm trying to explore TikTok. I am in between being a millennial and a Gen Z. That's actually the year I was born, the
Absolutely.
transition between being a
Yeah.
millennial and a Gen Z. So I'm also trying to navigate TikTok, but you can follow me at Adekunbella, right? I'll be sharing more on health, fitness, right, and lifestyle. I'm definitely just transitioning into the career that you want. So you can follow me there as well. You can send me messages. I'm very open to connect. You can reach out to me on my website, read up on my blogs and all of that. And I'm always happy to comment. I'm also going to be writing more this year. So you can follow me on Medium as well. So, and I'll be happy to connect and share any insights.
Yeah,
Thank
thank you
you.
so much. Thank you so much, Dekumbi. And that will be all for today. So thanks so much for
Thank you.
joining us. Until next time, I remain Gabriel.
Thank
Okay.
you so much, Gabriel.
Bye.
Bye. Have a great weekend.
And you too
Bye.
as well. And you too as well. Bye.